So, what are some of the ways that you've seen that programs have been able to integrate services that support people who use substances?
So mostly we've seen a lot of referrals and partnerships being made on the community level for internal, sharing of resources and educating on around, here's what DV do, here's what we do as advocates. And then the systems in the community say, here's what we do, here's our resources. We also have more clinical staff, clinical social workers in our field now more than ever. So we do have a lot of clinical staff that are in program that are able to assist in that way without, again, this forced recovery option that can take a kind of deeper dive than our general DV advocates can, because we want to make sure that we're staying in our lane and not causing more harm inadvertently, but we're here to support along the way as well. And all of our advocates, they do research or outreach and trainings, and they hold groups. They do go into, inpatient and outpatient recovery centers to do, healthy relationship education and just connect them with DV resources so that folks in substance use recovery are able to access our services, because oftentimes they don't know that we exist. And then also collaboration with harm reduction communities and advocating for universal access and training for like Narcan, safe consumption zones, having clean needles and cotton accessible, and fentanyl testing kits are really important and easy ways that you can help support without having to, go outside of our realm, right? We can have those like in a drawer in the agency. And then if somebody is active in use, like talk about safety. It's part of the safety plan of how are you staying safe while using? Are you testing? Here's a free kit, and getting all the training around that as well.
Yeah, there's so many options. And what I heard there really was that there are so many different ways that programs are integrating responses and resources and services for people along the continuum from non-use to use. So there really isn't any one size fits all. And that goes back to what you were saying earlier around really having those survivor voice and survivor defined resources.
Absolutely.
And so a question that we've often gotten is, how can programs balance supporting survivors who are active in their recovery and understanding that recovery is defined by the person, and that there are a lot of different ways that people engage in recovery, and that really people define for themselves whether they're in recovery. Nobody else can kind of define that for you. But supporting survivors who are active in recovery while also making sure that they're maintaining voluntary services.
Yeah. So I think first, it's really important for advocates to be aware of implicit and explicit bias, right? Because that plays a really big role in how we interact with survivors as a whole, right? With any survivor. So really working through those ideas that they hold around what survivorship actually looks like. And then also then taking into account how we feel about what substance use, folks that are active in substance use look like, and really break that down to be able to truly hold and create space for a survivor to, identify for themselves what they need from our service, right? We don't exist to mandate people to come into shelter or to seek counseling or use any of our resources. This is no different. So, making sure the advocates are explicitly clear that if a survivor needs to focus on recovery, that DV services are still available to them, right? It's not an either or, it's not you have to, then I will kind of stuff by any means. And, sometimes, DV advocates may be the only safe support system for that survivor. And, being aware of the limitations that exist specifically for marginalized identities, particularly queer identities that exist with traditional recovery centers can be really harmful, right? Because they can go into these systems that cause even more harm on top of the things that they carry in before us, and then their DV experience from, that resulted in them finding us. So it's really important that we're aware of kind of what that actually looks like, right? Letting the survivor define it out, talking through all the options of do you want to stay in communication with me? Do you want me to leave you alone? Because that's also okay. So really just figuring out how we fit into the story that the survivor is painting for themselves and how we can support them along the way, rather than trying to pull them along into what we think and making our services based on, oh, you need to go to rehab, we'll deal with you later, or we'll hold a bed till you're done, and not doing that because it's not helpful for anyone. It's dehumanizing, it upholds the stigma. And again, it's going against every principle of advocacy that we have in our movement, which is to be survivor-centered. So really just focusing on what they need and seeing how our services can mesh into what their needs are.
Yes, yes. And it's so important to recognize exactly what you said many important things there, but I want to uplift the piece there that, for people who experience discrimination based on their social identity, treatment may not be an accessible, a safe, a culturally responsive place for them, a healing place for them. And so, not all treatment centers are created the same.
Yes.
And that as somebody who is potentially genderqueer, transgender, and going into an inpatient setting that is sorted by gender, right? And is it actually gender affirming? Is it actually safe for people? What does that mean? And that actually is, if we are finding those things out actively, and helping to cultivate those responsive resources and those trauma-informed resources, then we may be connecting somebody to a service where they're going to be re-victimized. Yeah.
Yeah. And then also at the same time, that diminishes their trust with you, right? Because, encouraged me to seek this place out, or you didn't tell me that I would be so invalidated. And again, that results in your trust with the survivor being broken. So it's really important that we know what the community resources are, know what is and isn't affirming. And again, sharing that, hey, just so you know, this place is not the most, affirming place. How can we keep you safe? Is this something you still want to do? And then again, playing a role as an advocate in that safety plan to keep them safe emotionally and physically while they're engaging in recovery, since that's where they want to be and want to include you. It's important that we don't just kind of pass them off and kind of, oh, well, that's what it is. Because we want to keep that trust built with survivors, because for them to disclose that they're a survivor is an honor, right? That's not something we expect from people to do. They don't have to tell us that, but they do. They share that with us. And then also when they share that they are active in use or trying to recover, that's also a really big honor to hold, that they're a gift that they're passing on to you of themselves. So it's really important that we understand what to do with that, to cherish it and honor it and help them move forward through it as well.
Yes, yes, to cherish and honor it. Yes, and be that support in the way that they define. Yes.